just again, for clarity's sake, we hear about warts all the time, and I think most people associate a wart with some growth on the skin someplace. There is such a thing as genital warts. Tell us a little bit more about that. What's believed to be the causation, and how would one know if one has that?
Well, a lot of times people don't know that they've been exposed to HPV because more often than not, it's very small, microscopic in fact. But there are cases where there are some types of the human papillomavirus that just cause viruses in the genital area. Mm-hmm. So that would be the vagina, that would be the cervix, that would be the vulva or the outside lips, that would be the penis near the anus or the rectum. Mm-hmm. And those, you may sometimes need the aid of a special microscope to look and put medicine on, some vinegar-like medicine on to actually see those changes. But in some people, particularly those that for some reason are immunocompromised, they might be taking steroids or they might be exposed to HIV disease, in some cases those warts, or just normal people who've been exposed to a large amount of the virus, may develop cauliflower-like lesions that are on the vagina or the external part of the body.
And just to go back to the vaccine for a minute, because one of the things that I wanted to make sure we made sure people are clear about. Sometimes people think that getting a vaccine is somehow going to cause them to get the thing they're being prevented from getting, like the flu vaccine. Many people say, I don't want to get a flu shot because it might give me the flu.
Right.
You mentioned that this was not the virus itself that's in the vaccine, but it's a viral-like particle that causes a reaction in the body producing antibodies.
That's right. It's made out of the proteins that coat the virus, not the virus itself. So you don't get HPV from the vaccine.
All right. I want to get back to the vaccine for a minute. Who should get the vaccine? What are the ages that we recommend this for? And how would you respond to a parent? This is very important. Who says, I don't want my daughter to get this vaccine because I don't want to encourage her to become sexually active.
Well, that's a loaded question, but first, your first
question. That's what we're here for.
Right, is essentially the vaccine is most protective in people who've never had sexual activity. Sexual activity meaning intercourse or any contact of one genital organ to another. Mm-hmm. And the reality is that age is hard to predict in our society. And so the vaccine is really been studied for girls as young as 9 mm-hmm. up into young women up to the age of 26. Mm-hmm. If a person has never been exposed to human papillomavirus, then the vaccine is virtually 100% protective. If a person has been exposed to one of the 4 types of HPV, then they'll have somewhat less than 100% protection. So in answer to the question about the mom who is concerned that
yes.
giving a vaccine would then be somewhat of an endorsement of sexual activity, I would say that there are very few cancers that we can prevent, mm-hmm. And this is one of them. Mm-hmm. One of the side benefits of the protection of this vaccine is that it also protects against genital warts, which, while not life-threatening, can be very problematic. Mm-hmm. You may, determining the age of sexual activity and when that might occur or where it might occur, under what circumstances, is very variable in our society. And this is one way that parents can protect their children. And, certainly it requires a lot of discussion, but
sure. But the bottom line is right. it will protect our
It will protect,
kids.
Much like hepatitis
right.
vaccine, much like meningococcal vaccine.
And perhaps we can continue this in the next segment, but just maybe one more question about if a woman is already sexually active, is the vaccine effective? Just give me a quick yes or no on that one.
It's less effective than if he or she had not had any sex.
Okay. After one has received all of the doses of the vaccine, is there anything else that she needs to be concerned about from that point forward?
Well, we still need to practice safe sex. It's not protective against 100% of the viruses
right.
that cause cervical cancer. Young women still need to undergo regular pap smear screening. Mm-hmm. Because, again, for the same reason.
That's a very important point.
Right.
They still need to undergo regular pap smear screening. And again, this is Cervical Cancer Awareness Month,
right.
which is why we're talking about this today. Stay tuned. After the break, Dr. Brooks and I will be joined by Virginia Bradford to continue our discussion about this very, very important matter. Joining Dr. Sandra Brooks and me is Virginia Bradford. Virginia is the coordinator of the Harriet B. Porter Cancer Education and Research Endowment of the Kentucky Cancer Program. Virginia, welcome to Health Matters.
Thank you, Dr. Troutman.
Dr. Brooks, I understand that there's a wonderful new collaboration going on in our community to reduce cancer rates, particularly rates of cervical cancer. Can you tell us about that?
I'd be glad to. This is really an exciting initiative, and we're really proud to be partnering with the Kentucky Cancer Program and the Department of Public Health and Wellness. Will be launching a mobile prevention center in 2008 that will allow us the ability to go to multiple locations throughout the city to provide screening for cancer of the breast and cervix, which is what we're talking about today. We'll also be providing information about colon cancer screening and performing screening for cancer of the prostate as well. And this is really, and part of the Mobile Prevention Center will also allow us to provide digital mammography. So we're going to be, we're working with a number of community organizations, cancer-related nonprofit groups, local businesses to come together to try to really attack the tremendous problem that we have with cancer in this city. And working in partnership with people who know the city, who know the community leaders and organizers, I think it's really a key part of the success of this effort.
I know that the city really should be excited about the fact that this is happening. And I also know that a lot of this has started since you came on board with Norton. So I want to congratulate you on the progress you've made in such a short period of time. Virginia, the Kentucky Cancer Program and the Brown Cancer Center have been working for years, literally, to reduce cancer rates amongst women in our community. How are you involved in this new collaboration?
Well, you know, we're excited again because we started over 17 years ago with the Partnership in Cancer Control. And that's our mobile mammography unit through the Brown Cancer Center. And so this is just being able to expand the services in the community, and we're excited about that. So we've been out there educating and screening as well for the breast, cervical, and prostate cancers. And so working with Norton Cancer Institute and the Louisville Metro Public Health and Wellness, we'll be able to really expand what we've been doing and screen more women.
So what sorts of cancer are we concerned about? What sorts of cancer are being are organized to be screened for through this program?
We're really looking at cervical cancer with this first part of the project starting in January. And I know that we've got, 3 different sites in January that we're going to actually be performing the Pap test for the women. So we're encouraging women 40 and older to come out and be screened.
At no cost to them.
That's
At
right.
no cost to them.
Right.
That's
Yes.
important to say again, at no
That's
cost to
right.
them.
Right.
So-
We encourage people to make appointments, but walk-ins are welcome. I know we'll talk about the number at the end, but I'll give it now, 629-1234 to schedule an appointment. And this is an ongoing collaborative, so it's really so important because, again, cervical cancer is preventable. And we do have multiple opportunities. Oftentimes, if you talk to women who develop cervical cancer and you ask, when was the last time you had a pap smear? The answer is more than 5 years ago, or after my last baby, 10 to 15 years ago. You know, there are a variety of reasons that people might feel a bit shy about coming out, but just to know that when they do come, they will be welcomed, and that we will do our best, very best, to take the best care of you.
It seems that 2 of the major reasons that people give for not coming out is, number 1, they can't afford it,
Right.
and number 2, it's not accessible.
Exactly.
It would seem that with this program, you've eliminated both of those potential reasons for not coming out because it's at no cost, and you're bringing a mobile facility to where people are.
Right.
Exactly. And we're also providing an incentive. We will have gift cards for the ladies that come out, just to say thank you for making yourself a priority.
So there's, again, no reason.
No
Plus,
reason.
there's an additional incentive to come out
Exactly.
And get screened.